Hello friends, today let's discuss some commonly asked entrance questions. The chromosomal abnormalities are features of all except Down syndrome, cleft palate, chronic myeloid leukemia, and Turner syndrome. We know that Down syndrome is a chromosomal abnormality resulting from trisomy of 21st chromosome. The Klinefelter syndrome, there is trisomy of the 46th chromosome. The Turner syndrome is a monosomy of the 45th, and chronic myeloid leukemia, the chromosomes affected are number 9 and 22. Whereas cleft palate happens in the 14th week intrauterine life due to failure of fusion of the palatine shells. So the answer for this one is option B. Routine radiographic examination of a 6-year-old child discloses a supernumerary tooth between the central incisors. The dentist should do what? If you look at the radiograph, you can see a mesiodens that is located between the central incisors. So if that mesiodens is not extracted as quickly as possible, then it can result in ectopic eruption of the succedaneous central incisor. Like this image in which the central incisor is more labially placed compared to the position of this adjacent central incisor. So it should be extracted as soon as possible without any injury to the central incisor. So abnormality in morphodifferentiation stage can result in what? So this table shows the abnormalities and the resultant effects. So abnormalities in the initiation stage can result in missing teeth, fusion, gemination. Abnormalities in proliferation can cause supernumerary tooth and odontoma. Abnormalities in histodifferentiation causes amylogenesis imperfecta and dentinosis imperfecta. In morphodifferentiation, it causes microdontia, macrodontia, and pec teeth. So the answer for the fourth question, abnormalities in morphodifferentiation can cause indenting. Dentinosis imperfecta occurs as a result of abnormality in the histodifferentiation stage. So learn this chart by heart. Supernumerary teeth are all except, as seen in all except. So supernumerary teeth are seen in Gardner's, cleft palate and cleidocranial dysplasia, but it is not seen in ectodermal dysplasia. Learn that. So which of the following is not seen in cleft lip and palate? So a cleft lip and cleft palate is characterized by features like hypoplastic maxilla, shallow gingivolabial sulcus, nose deformity, supernumerary teeth, congenitally missing teeth, feeding difficulties, posterior crossbite, etc. So the only thing that is missing is the developmental cyst, so that is the answer. The overall findings in erythroblastos fetalis is mainly what? It is the formation of pigments in the teeth. We know that erythroblastus fetalis it is a Rh antigen mediated disease in which mothers WBCs fight against the RBCs of the child. So pigmented teeth is a characteristic feature of the erythroblastus fetalis. The second most common supernumerary tooth is what? We know that the first most common supernumerary tooth is the mesiodens. Then there is the fourth molar in the maxilla. Then there's a fourth molar in the mandible. So by the fourth molar, I mean the additional molar that is found distal to the third molar. That is more common in maxilla than in mandible. Then there is a maxillary paramolaris. That is the molar present on the labial or buccal or the lingual aspect of the molar. That is the third most common. That is maxillary paramolaris and mandibular premolaris. Paramolaris, then the mandibular premolars and maxillary lateral incisors. That is the order of the frequency of occurrence. The developmental cause of cleft lip is the failure of what? If you look at this table, it is clear that failure of the fusion between the maxillary process and the medial nasal process result in cleft lip. Oblique facial cleft results when the failure of fusion between maxillary process and lateral nasal process occurs, and midline cleft occurs because of failure of fusion of the medial nasal process, and cleft palate occurs because of the failure of fusion of the palatal shells. A distinctive proliferative clinical entity originating as a response of the oral tissue to local irritation that occurs at any age on the gingiva is known as pyogenic granuloma. This is the definition of the pyogenic granuloma. According to Burley, the most common ankylosed tooth is the primary mandibular first molar. That is the most commonly ankylosed tooth. Median palatal cyst is a fissural cyst. Fissural cyst is a type of non-odontogenic cyst that occurs along the line of fusion of various bones or embryonic processes. Etiology of mucocele is related to a trauma to the minor salivary gland excretory duct. So when there's a trauma to that excretory duct, there's an obstruction and the saliva gets collected and it swells up. That is a mucocele. A patient feels that his molar is extruded from the socket and is tended to percussion. So that is typically because of a periapical abscess. When there is an abscess formation, it tries to tend to push the tooth out of the socket and the tooth will appear elongated for the patient. Cellulitis is defined as an inflammation of the deep fascia. A bacterium not associated with caries process is the Staphylococcus aureus, which is associated with skin and soft tissue infections. Whereas Streptococcus mutans can cause soft tissue caries, Lactobacillus acidophilus can cause occlusal caries, and also Actinomyces can cause root surface caries. The acid in saliva is neutralized by the salivary bicarbonate ions. The facial spaces involved in Ludwig's angina are the bilateral, submandibular, the sublingual, and the submental spaces. Bilateral, submandibular, sublingual, and the submental spaces. The correct IQ for the child is 90 to 110. So most of the children fall under the category of the average IQ, which is 90 to 110. Anything more than 110 is considered high IQ, and lower than 90 is low average. It is recommended that brushing of a preschool child be performed by the child's parent. In a child having gingival swelling, brushing is best done with the help of soft 2 to 3 brush with round bristles. So the most common types of toothbrushing techniques are the horizontal reciprocation technique or the scrub method, then the vertical sweeping method, circular method by the phones, and the vibratory method. Least cariogenic sugar is xylitol, so it can act as a sugar substitute. The last primary tooth to be replaced by permanent successor is the maxillary canine because it erupts at the age of 13. First organism to appear in the oral cavity is the Streptococcus salivarius, followed by Streptococcus mutans, which are introduced into the child's mouth by the mother. A 5-year-old child is given an extended course on tetracycline drug. Which of the following teeth are likely to be affected? That is the canine, premolars, and the second molars. Let's see how the age time in which they are affected. So the age of administration is 4 months in utero to 3 months postpartum, then the primary incisors will be affected. If it is 5 months and 9 months postpartum, primary canines will be affected. At 5 years of age, canines, premolars, and second molars will be affected. At 7 years, no teeth are discolored. 4 months postpartum and 8th year of child, permanent anterior canines, premolars, and first and second molars are affected. So the tetracycline analogs that does not cause tooth staining includes doxycycline, methacycline, oxytetracycline, and anhydrotetracycline. In 8-year-old child, tooth is not erupting due to lower incisor crowding and presence of retained deciduous lateral incisor. So once we extract the retained deciduous lateral incisor, it is capable of erupting. If the second deciduous molar is lost prematurely, maximum space loss occurs during the first 6 months. A 9-year-old patient exhibits lingually locked left permanent maxillary central incisor. Supporting bone is in harmony with the two sides and there is no basic discrepancies in other relationship. The most probable etiological factor is the prolonged retention of the primary maxillary central incisor. That is, it was not extracted at the proper time. That's why it erupted behind the deciduous tooth. The early loss of deciduous teeth causes delayed eruption of the permanent teeth. Primary objective for not extracting the primary teeth is to maintain the arch length. In primary dentition, the anatomic structure used to determine the molar relationship is the distal plane of the primary second molars. So if you look at this portion, this is the distal plane of the primary second molar, which is in a vertical relationship with the distal plane of the maxillary second molar. So this kind of relationship is known as the flush terminal plane. So what if the distal plane was more mesial to the distal plane of the maxillary second premolar? Then we call it as a mesial terminal plane, and if the distal plane is more distal to the maxillary second premolar, we call it as a distal terminal plane. The distal shoe spacemaker is mainly indicated to guide the eruption of the mandibular first molar. The distal shoe spacemaker is indicated when there is a premature loss of the second primary molar or at the time of extraction of the primary second molar. There are two types of distal shoe spacemaker, that is the removal type and the fixed type. Under fixed type comes the Willet's fixed distal shoe space maintainer and the Roche's fixed distal shoe space maintainer. So the treatment of upper and lower crossbite in 5-year-old child is done as early as possible. In an 8-year-old child, the first molar is extracted due to caries. The treatment of choice is wait for the second molar to drift mesially. The logic is that once the first molar is extracted before the eruption of the permanent second molar, it is capable of bodily displacement and occupying the position of the first molar. But if the first molar extraction is done after the eruption of the second molar, then bodily movement does not take place. Instead, tipping movement will take place. Which of the following situation is space is most difficult to manage? A 5-year-old with the loss of primary mandibular second molar. Because the primary mandibular second molar will be replaced which very later on the later stage. So if it is lost, then the maximum space loss will be happening within the first 6 months. Clinicians should avoid using the compound forceps for extraction of primary molars because it poses great possibility of injury to the crypt of the permanent tooth. The crown horn is having a tip like this that when engages the furcation area can cause damage to the succedaneous tooth bud. So it should not be used. An ankylosed primary molar may result in all of the following except failure of the calcification of the permanent success. The ankylosed primary molar will be a serious problem for extraction. It can cause delayed eruption of the succedaneous tooth and can cause arch length loss. A 9-year-old child has a lingually locked tooth wound. The most probable cause is prolonged retention of its predecessor deciduous tooth, which is 6-1. The time of greatest sensitivity of an organ or system to environmental influence or hereditary pattern is called growth spurt. Following are the timings of the growth spurt: just before birth, 1 year after the birth, mixed dentition growth spurt. Boys, it is 8 to 11 years, and girls, it is 7 to 19. Then the adolescent growth spurts: boys, it is 14 to 16, and girls, it is 11 to 30. The intrauterine fusion of the primary palate occurs at 4 to 8 weeks. The height of the maxilla is increased by the growth of the alveolar process. Interdental spacing found in the maxillary arch of the deciduous dentition is 4 mm. Fusion of mandibular symphysis occurs at 18 months. From a clinical standing, the most significant overall sexual difference are seen in the achievement of the facial height. The stage of relatively rapid eruption from the tip of a tooth first penetrates the gingiva until it reaches the occlusal level is called post-emergent spurt. By what age does the startle and the grasp reflex disappear? By 2 years of age. Now, startle reflex is initiated by a sudden noise or any other stimulus in which the elbows are flexed and the hands remain closed. In grasp reflex, when the baby's palm is stimulated, the hand closes. Both normally disappear by the 2 years or 24 months. The easiest and the most natural method of brushing technique recommended for preschool and young children is the circular scrub method. In the absence of second premolar, the roots of the primary second molar will most likely resolve more slowly than the normal. So only if there is an underlying succession to the roots will resolve. When it is absent, the roots will resolve more slowly than the normal rate of resorption. The most difficult form of child maltreatment to identify is the Manchurian syndrome by proxy. The salivary flow rate is considered less when the flow is below zero point 0.5 ml per minute. The normal rate of salivary flow is 1 ml to 2 ml per minute. The digital shoe was first advocated by Willett. The maximum amount of space loss occurs due to early loss of the maxillary second molar. The number of frontal present at birth is 6. At adult stage, it is 2. In Down syndrome, an additional frontal will be present, so the number will be 3. Vertical inclination of the permanent tooth to primary teeth. The primary is more vertically oriented than the permanent. The type of space maintenance advised when there is a bilateral loss of the tooth is the lingual arch holding appliance. Calcium hydroxide was introduced in endodontics by Herman. The approximate age at which the child begins to walk is before the first year, that is 9 to 12 months. Which of the following molar relationship is the most common in primary dentition? The most common one is the flush terminal plane. Dentists did restoration of 11-year-old child, found primary molars in various stages of exfoliation with anterior crowding. He should give the next appointment after 3 months of follow-up. The pulse oximetry is used to determine the oxygen saturation. A non-invasive method to measure the blood flow is the laser Doppler flowmetry. Maximum increase in number of microorganisms in the mouth is seen at eruption of the deciduous teeth. When the first tooth erupts, maximum number of microorganisms starts erupting because it is the tooth to which the microorganisms are bound to with the help of dextrans. In orthodontic, proximal caries of deciduous molar causes reduced arch length. Riga fidei disease is caused by aberration of the tongue by the teeth during sucking of the milk. The best time to begin the counseling of parents and establishing a child's preventive program is before the birth of the child. In case of a conscious sedation for children aged months to 3 years, clear liquid should be stopped. According to AAPD, for a child undergoing sedative procedures, the human breast milk should be stopped at least hours before the procedure, that is 4 hours before the procedure. Computer-controlled local anesthesia delivery system is known as the WAND system. Lesch-Nyhan syndrome is associated with masochistic behavior of the child, that is self-inflicting inflicting injuries to oneself. Best time to see a 3-year-old child in the dental office is early in the morning. The faciolingual dimension of the band and loose pain should be 8 mm. The preferred route of anesthesia for a child is all except. The best one is the oral, then there is IV, IM, submucous, but not the intradermal. In performing mandibular nerve block for a child, the most probable cause of failure is because of a different angulation of the needle. The needle should be directed more inferior for the mandibular nerve block in children and more superior for the nerve block in the adults because of the location of the orifices. According to Finn, the best method of brushing in the mixed dentition and young adult dentition phase is the Pons method. Routine radiographic appearance of a child discloses a supernumerary tooth between the central incisors. The dentist should extract immediately without damage to the permanent tooth. A 5-year-old child is given an extended course of tetracycline drug. Which of the following teeth are likely to be affected? At 5 years, canines, premolars and second molars will be affected. Tetracycline can be given after 8 years, or else we use substitutes. Tooth eruption generally occurs when root development is completed by 75% of the total length. Toddlers are 1 to 3 years of age. At what stage congenital defects are most pronounced, especially when certain teratogenic agents interfere during the development of the embryo? This 4th week of intrauterine life. Rabidam is particularly adapted to primary tooth because of the cervical constriction of the crown favors its retention. Now, what cervical constriction? So this is the gingiva, this is the cervical constriction of the tooth, and the clamp engages this portion which provides it additional retention. Change in arch length from mesial surface of the permanent first molar between the ages of 6 and 18 is decreased by 1 mm. So a sugar substitute that is bactericidal is xylitol. During the development of speech function, the first speech sounds acquired at the bilabials when the two lips come in contact like the B, M, P all are bilabials. For development of mandibular incisor, which of the following gene is responsible? It is the MXX1 gene. In a stainless steel crown on a deciduous molar with overhanging margins, gingival pain and inflammation occurs due to retention of the plaque. A child patient is very uneasy and not able to hold the X-ray film. Then in this case, who can hold the film in the patient's mouth? The parents can hold the film further. So that concludes my presentation. Thank you.